Thanks. Well, new statistics show that plastic surgery is bouncing back with the economy. The total number of procedures was up last year, and it's not just for the ladies anymore. Dr. Darshan Shah is a plastic surgeon with practices here in Bakersfield and in Malibu, joining us to talk about this. Now, have you seen that in your practice? Have you seen more men coming in asking for procedures?
We actually have. I mean, this year we've seen more people on the whole come in just because the economy seems to be turning around, but definitely more men are coming in.
And what are they embarrassed about it? Are they kind of trying to hide it? Because it doesn't seem like the manly thing to do, you know?
You know what's really interesting about it is that a lot of men, they used to be embarrassed about it, but now that it's getting more accepted in the media, they seem to be just coming in without any reservations.
Who are we what kind of guy, what age groups are we talking about? Who is it that's coming in as far as the guys go?
It's usually, you see two groups of men. So some of them are in their younger years, like in their 20s, 30s, are coming in for a little bit of liposuction, and then you see men in their 40s and 50s coming in for Botox. And what we've really noticed that's interesting is that they are actually considering facelifts now. So we see men in their 50s, 60s getting facelifts.
And that typically in the past was more, women getting that done.
Right, right.
Do we have any idea why? Is there a social? I mean, we know there's more. Right. Socially acceptable now, but do they have a reason why they say they're coming in?
It's really just they're feeling more and more accepting of it. They've seen years and years of people go through without any reservations. So more people are just socially accepting of it. I think that's the main reason.
And I've heard theories that there's some thought out there it can help at work professionally, to get ahead of work.
Right. It's a little bit different for men because sometimes that gray hair actually connotes some experience.
Yeah.
But I think some men do want to keep that younger, youthful look going in their workplace as well.
Now, one thing I quickly wanted to touch on, this report that came from the American Society of Plastic Surgeons shows that procedures for men were up 2%, but teenagers were also up 4%. What is your stance on that as a plastic surgeon? Say, and breast augmentation was one of the most popular procedures. What is your stance if a 17, 18-year-old girl comes to you looking for something?
That's a great question. Usually we encourage the teenagers to wait at least until their early 20s and come in again when they've had some more time to think about it. However, sometimes we see some women or teenagers coming in for more reconstructive type procedures.
If they've been injured or something like that.
Right, injured, or they just have a deformity that they're trying to fix that really embarrasses them at school. And then if they're there with their parents, we tend to listen to what they have to say, and if the parents are supportive and we really think it'll benefit them, we give them the green light.
All right, Dr. Darshan Shah, thank you so much for stopping by.
Thank you.
Right.
Thank you.
Canby?